Good day, sir. I'm Maraming Pimpak Tanak, student nurse of Holy Trinity University. So, I'm going to application of hot water bag of the patient. So, the hot application is application of a hot agent, warmer than skin, either in the moist or dry from on surface of the body of the patient. So, the first purposes is to relieve pain of the patient, to have absorption of the hematoma, then to have the patient with urinary retention to pass urine, to keep a patient of hypothermia warm, to keep a newborn baby warm in condition like premature birth, asphyxia, hypothermia, and etc. of the patient. So the special consideration of the procedure is do not use water at the temperature more than 48 degree when to be used for small children and patient with heart disease. Do not place the bag under the body at any time. Do not use hot water bag if the patient is unconscious or paralytic with loss of sensation. As accidental burn can occur the patient. Change the position of the bag after 5 minutes. Remove the bag if the site of application of the bag becomes red. Apply talcum powder locally. So the equipment is hot water bag, bath thermometer, linen cover, or pitcher and pitcher of hot water. So, ma'am, again, I'm Armin Pipaktanak. Now, I'm going to application of hot water. Okay lang po ba? And may I know your name, or you state your name?
My name is Ryan.
Your age? Okay, ma'am. Thank you. And relax ka lang po. So now, I'm going to clean the hot water bag with clean water. Open the hot water bag and use clean water. And knock again. If there's leakage of hot water, up and down. Then remove the water. And fill the bag about 1/2 to 1/3 full with water at 55 to 60 degree. Then filling the bag 1 to 2 to 2 to 3 full only will prevent discomfort to the weight of the water. So I'm going to use hot water 55 to 60 degree. Do not pull the hot water because 1/2 of the hot bag. So place the bag on the flat surface and remove all air from the bag. Close the mouth of the bag to fork conductor of the heat and fill add fork of the bag. So and bend the bag dry of outer side of the bag. So to confirm that if does not leak, cover the bag with the cloth or a cover. So I'm going to close the hot water bag. Then up and down if there's leakage, or then let the hot water bag and cover it. So if you use the hot water bag, place it gradually over an area, warm water by towel, then applying the bag slowly will give patient time to test the temperature of the bag. Then if after the 5 minutes, change the water inside when it cold. Refills are necessary to maintain desired temperature. So I'm going to use this hot water bag to the patient. Okay lang po ba yung init ng hot water bag, ma'am? Then, I'm going to remove after 5 minutes. Thank you, ma'am. Then, empty the bag after use. Dry it well after inside and outside. Let some air in and keep it in a cold, dry place. In flattening the hanging, I will prevent the inner surface from the adhering to each other. So, I'm going to discard the water of the hot water bag. Then make sure the hot water bag is no water. Then lock it again. Then make sure the hot water bag is no air. Then document the procedure for legal purposes. Thank you. Thank you, ma'am, for your cooperation, and God bless. Thank you, sir.